It's been well established that stress plays a vital role in the development of essential hypertension. Due to an imbalance in the autonomic nervous system, a lack of vagal tone, and a swing towards sympathetic nervous activity, there's been a shift in our default towards a heightened and poorly managed stress response. As a result, heart rate increases, the ventricles contract more forcefully, and there's an increase in resistance in the circulatory system due to constriction of blood vessels. Over time, this leads to increases in blood pressure, as well as risk of stroke, cardiac disease, kidney failure, as even death. The majority of medications that are given for blood pressure are actually aimed at decreasing sympathetic nervous activity and increasing the sensitivity of the heart to blood pressure changes, the barrel reflex. Here's the crucial thing. Breath control can do that too. In fact, reducing breathing down to 6 breaths per minute has been shown to improve the barrel reflex in patients who are healthy, suffering with cardiac failure, as well as hypertension. A statement made by the American Heart Association suggests that slow breathing, or breath control, is a type 2A evidence B procedure, and therefore making it a reasonable protocol to use in the management of high blood pressure. With 8 to 9 weeks of roughly 10 to 15 minutes a day of slow breathing has been shown to reduce blood pressure by 14/7 millimeters of mercury, and therefore can decrease the classification of severity by 1 or 2 levels. At the pinnacle of all scientific evidence is the meta-analysis. This is a collection of all randomized control trials with similar outcomes. Chadha et al. Looked at 27 studies looking at slow breathing and its outcome of hypertension, and suggests that systolic blood pressure can reduce between 2 and 8 millimeters of mercury, and diastolic between 1 and 4. However, they also suggest that the longer the patients actually practice for, so those who practice for more than 200 minutes per week, got better outcomes. I have devised an 8-week stress relief breath control program, and here I present a case of a 35-year-old male who is suffering with shortness of breath and mild hypertension. He was an ex-commando officer and has a history of testicular cancer, and therefore has a stressful and traumatic past. And he has been enrolled with me on online coaching breathing for 6 weeks now. He started at 5 minutes per day and is now up to 15 minutes per day, and we are seeing his blood pressure drop from 140/90 to 125/80, which is roughly textbook blood pressure. His heart rate variability is increased on his Apple Watch by 11 points, suggesting greater cardiac autonomic control. His perceived stress level has come down. His shortness of breath scores have also come down. And he is observably healthier, happier, and his family is saying he's more calm and active than he's ever been. This is just a small amount of evidence of the abundance of it out there that I'm presenting you today. So I please ask you, in patients who have mild hypertension or pre-hypertensive, who might not want to go on to medications, might have a stressful background or even a bit of shortness of breath, please refer them for breath control, or think about using breath control as a means to support your individuals. I've placed the citations for this video at the end, for this presentation at the end of the video, and I look forward to having a conversation about how I can help your patients further. Thank you.